So tonsillectomy is the main treatment modality for obstructive sleep apnea, and even in perfectly normal children with only obstructive sleep apnea, it can be curative in 80%. But in children who have obesity, children who are younger than 3 years of age, or children with craniofacial abnormalities, their response to this treatment, tonsillectomy, can be as low as 50%. So these children have unmet needs for treatment of obstructive sleep apnea, and even medical treatment with nasal steroids or anti-inflammatory treatment may not be curative. So we need non-invasive ventilation for these kids, and although there are a lot of developments in this area, we still do not have the perfect masks, and we do not have the perfect triggering mechanisms, especially for younger kids. In children with OSA, in the European Respiratory Society guidelines that we published, we recommend a stepwise treatment. So one of the treatments that are available to these children is anti-inflammatory treatment, because we know these kids have increased inflammation in their adenotonsillar tissue. So one of them is nasal steroids, and the other one is montelukast or anti-leukotriene antagonists. So these treatments can be used in children who have mild to moderate obstructive sleep apnea, and we need to follow them up, but especially if children do not respond to the tonsillectomy perfectly, these are viable treatment options. Another option is orthodontic treatment, and recently myofunctional treatment is also coming in a lot of studies, also in children as well as adults. So these are all the options that we need to consider, maybe instead of tonsillectomy or in addition to tonsillectomy. So the most important diagnosis is that we are now becoming more, I think the new thing in diagnosis is that we're coming up with new studies that use polygraphy and overnight oximetry in children. So we recently showed in a population of Down syndrome children that we published in ERS abstract, and we're submitting the paper, that even in children with Down syndrome, obstructive sleep apnea can be diagnosed with polygraphy. So these are studies that do not include EEG or other electrodes that are required for sleep staging, but you can look at the respiratory parameters, and that can still be helpful. And these studies, because they are easier to perform, they are cheaper, and they can be done at home, will probably be the future of diagnosis of obstructive sleep apnea in children. They are already widely used in adults. And another option is using overnight oximetry. So this is also very cheap and easy to approach in diagnosing children with obstructive sleep apnea. So this is another thing that we have been studying more and more. I think this would be the way to go in the future, and we'll probably say the polysomnography for more complex kids and for other sleep disordered breathing such as narcolepsy or hypersomnia and these kind of things.